supplier and distributor of medical equipment and hospital disposable since the year 2002, like I had mentioned earlier. And Megascope Healthcare Kenya Limited has gained and matched a reputation for our knowledge for vital hospital equipment used in critical care and anesthesia machines, radiology, central sterilization units, ophthalmology, dentistry, laboratory, physiotherapy, and electrotherapy equipment, to name but a few. So just to mention also a few of our customers, who include also KEMSA, is the government public hospitals, some of which are Kenyatta National Hospital, Moi Teaching and Referral Hospital, Jomo Kenyatta University Hospital, Ministry of Health, and also the private hospitals as well. Namely, we do have, and we do also supply to Aga Khan University Hospital. We also engage with the Kenya Red Cross, Medical Essential Supplies, who are MEDS, African Development Bank, Ministry of Education, Nairobi Hospital, Mata Hospital, Gertrude's Children's Hospital, St. Mary's Mission Hospital, Elgon View Hospitals. If I continue, then we shall leave here in the next 3 to 4 hours. So I want to say that besides the above-mentioned institutions, we also sell to private retailers as well across these counties of this country, beautiful country, Kenya. And our scope of business and operations has witnessed exponential growth from distribution of medical equipment to capacity building, with an objective to see that those in the medical fraternity, specifically biomedical engineers, become more adept in their skills. We, as Megascope Healthcare, have an already confirmed training center. This training center has also been is a center of excellence for both East and Central Africa, where we do train these biomedical engineers, radiographers, radiologists, and they come for this capacity building. So Megascope has also partnered with globally renowned brands such as Mindray Shenzhen in China, Neosoft Medical Systems in China, Tutnauer in Israel, Cavo Dental in Germany, Stefanix in France, Ahmed in China, and many other companies including US, UK, Europe, South Africa, Turkey, and also Pakistan. I would now wish to respond just to raise concerns on the question of the JACMA issues, and we wish to be very categorical and clarify that Megascope Healthcare Kenya Limited has never been registered as a clearing agent. I want to repeat that. Megascope Healthcare Kenya Limited has never been registered as a clearing agent of any sort, and as such, does not have the mandate to clear any consignments. Further, Megascope Healthcare Kenya Limited has never been engaged by any government agency nor KEMSA to clear any COVID-19 related consignments, including the donations from JACMA. Be therefore informed that we did not clear the JACMA donated COVID-19 cargo, and therefore have no further statement to this, as we are pursuing the matter through the court of law, as it has been alluded by our counsel, the lawyer, Joroge Rigero. And I'm here by my legal counsel to confirm the same, that the answer is no, we did not clear. I do want to also respond to your second question, which you asked a detailed report on what Megascope Healthcare Kenya Limited supplied to KEMSA since March 2020 and what was the procurement process undertaken. Megascope Healthcare Kenya Limited has been a supplier again since the year I mentioned, and we have grown in our client base, being a reliable supplier of quality healthcare products, of medical equipment in Kenya, and also providing solutions and turnkey projects. Among our clients is the Kenya Medical Supplies Authority, that is KEMSA, that upon detection of the first case of COVID-19 in Kenya. On 12th March of 2020, our clients in healthcare industry started their preparedness to ensure infection prevention and readiness to attend to patients with COVID-19. And among the preparedness was the urgent procurement of personal protective equipment that include coveralls with shoe covers, medical goggles, KN95, face masks, natural gloves, and face shields as well, and not forgetting ventilators. The items were sourced both as separate items and as a complete kit. The nature of items have not been regular medical supplies, led to KEMSA seeking samples from various suppliers, and in this case, Megascope Healthcare Kenya Limited, which was contacted by KEMSA requesting submission of any samples that were available for quality checks to enable KEMSA determine if they would meet their specifications that guided quality assurance. And upon quality checks of the samples and sample acceptance, we were issued with a commitment letter dated 17th March 2019, asking us to deliver available quantities on delivery notes. We were also issued with a pre-inspection quality report of PPE kits that confirmed the samples we submitted of various PPEs were acceptable. We also received a distress call on urgent need for a ventilator to rescue a patient who had been admitted in Msambweni Level 5 Hospital on 23rd March 2020 with COVID-19 and was getting respiratory distress. On this, we had an available unit of a ventilator, and given the life-saving nature of the need, we were tasked to deliver the ventilator via flight to Msambweni to rescue the patient from distress call. Honorable Chair, I'm trying to demonstrate that we as Megascope Healthcare fraternity put our lives on the line to try and save lives in this country. The said ventilator was dispatched under delivery note number 22119 on the procurement process followed in supply of COVID-19 items to KEMSA. Upon establishing that we had the capacity to deliver on the COVID-19 related items, which we had communicated to KEMSA through samples submission, the direct procurement process was followed, and this is the chronology of events I just want to take you through, Madam Chair. One is the letter of intent to supply at the stated selling prices, which is, of course, in one of the submissions. Commitment letter to supply urgently required items specifying the quantity and delivery timeline. Number 3 was we delivered on delivery notes. And 4 was upon completion of delivery, we received invitation to tender for supplied goods. We then, number 5 is tender bids were submitted and negotiations were conducted by KEMSA, which were also minuted. Number 6 was award notification indicating negotiated prices that were issued, and letter of acceptance was issued in responses to the award notification. We were issued with contracts that we signed at the time for each awarded tender. And the number 9 is local purchase order against each tender was also issued. Number 10, invoice to KEMSA was generated and submitted to them. Payment advice was to be issued to us on every outstanding payment. Number 12 is for items required after sales support, we follow up ensuring we install, commission, and also train the users on usage of equipment, including wearing the PPE kits. The COVID-19 pandemic brought about disruption of business and by extension the supply chain. So given that the items required were not regular supplies, we had to source all our supplies from China, who are the main global suppliers. And because the rule of demand and supply, production of items was hampered by safety measures, regulation, and only a few manufacturers were left in production. Global lockdown rendered limited air transportation. And accordingly, both the manufacturers and airlines adjusted their prices upwards. Of importance to note is the cost of air freight increased from 10